I'm Professor Bridget Featherstone and I'm Professor of Social Work at the University of Huddersfield. I have qualified as a social worker, so I've worked in the field, and my research is all in the area of child protection and family support. The immediate effects on children are often very apparent at school, for example, being withdrawn, not talking to their friends at school, not inviting their friends around because they're embarrassed, feeling ashamed. It can also immediately result in things like bedwetting, sleep disturbances, and general withdrawal. So it can be fairly immediately apparent that there's something quite wrong. The long-term effects on children. One of the ways that domestic abuse works is that children can become very estranged from the partner who isn't being abused, that the abuser compromises the relationship or affects the relationship. So children can be very distrustful of adults generally and can lack a loving relationship or can lack sources of good attachment within the family. I think there can also, especially with older children, be ambivalence, because they will love the person who's being abusive, but they'll want the abuse to stop. I've seen it where children have blamed, in the cases where it was a mother being abused by a father, I've seen children blame the mother for the father going to jail or for the father not being in the house. So it can affect a lot of different relationships in families and cause divided loyalties and a lot of confusion for children. The research behind what I've been talking about is extensive now, and it's international as well. I think initially when we became aware of domestic abuse, it was largely to do with women, and it was largely about the impacts upon women, and that would have been in the early 70s. But over time we realised that it impacted upon the whole family, and there has been an incredible amount of research done with children, talking to them, hearing what they think, but also looking at the impacts upon them. Like a lot of the US studies have looked at psychological impacts into adolescence and beyond. I think it can be very hard to go straight to services. I think that there are all sorts of reasons why, in my experience, people can be afraid of social workers. They might think, oh, my children will be taken away. They can be afraid if they're an immigrant, that because sometimes the abuser will have frightened them and said, you know, you'll be deported. They can be afraid because English isn't their first language. Tell somebody though. Usually your fears are ungrounded, and often people find, I know when I've done research, we've found that even telling a neighbour or telling somebody in your church or telling somebody in the community can be the signpost for services, definitely. I don't think we have enough services for domestic abuse offenders. It's one of the things that I think we should really invest in. I understand why people think, oh well, we need to give resources to the victims and to the children, but I actually think in the long run there is some evidence to suggest that that people can change. Not all, but some can change. I think where they can, they should seek help. I think that there is a lot of evidence now that if men are really understood, it's men the work has been done with. I know men can be abused as well, but often there is evidence to suggest that men, when they realise the harm they're doing to their children, actually that's a real motivator to change. So in a very, very short message to them would be, don't think you can be a good dad and be beating up your children's mum. Whereas some men do think that, oh, well, the kids don't hear it, or it happens when they're not at home, or whatever. That's not the case. Kids always know.